The term tennis elbow refers to inflammatory pain on the outside of the elbow, and in this video we're going to identify methods of treatment. Hi everyone and welcome to Exercise for Health. I'm Richard and today I'm going to take you through 7 various exercises and treatments for tennis elbow to alleviate the symptoms. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. Tennis elbow is the mainstream term used for the condition lateral epicondylitis. This is a tendinopathy of the common extensor tendon of the elbow, which includes the muscles that bend the wrist and fingers backward, as well as rotate the palm to face upwards. You don't have to be a tennis player to get this, but it causes pain and inflammation around the outside of the elbow joint. It's normally triggered by prolonged repetitive movements or poor positions of the wrist, and generally affects people in their 30s, 40s or 50s, and I've seen it in traditional martial artists such as karate or taekwondo that use the rotation of the fist at the point of elbow extension during a punch, as well as gym members that are having to rely on a strong grip while lifting any weight, particularly if the wrist is pronated, so palms facing down, such as a lat pull down or even during a deadlift movement. If you're getting pain radiating further down the arm or tingling sensations, then this is probably a nerve impingement. Generally, the pain associated with tennis elbow is very localized and it will be tender at a particular point. Also, a similar condition called golfer's elbow causes the same symptoms, but on the inside of the elbow, and I'll cover this condition in next week's video. Tennis elbow can last from a few months to a couple of years and can also have a tendency to recur if the cause is not managed correctly. It's also worth noting here that the condition can arise from a weakness further up the chain, such as the shoulder, causing the muscles around the elbow to be overloaded. So it's definitely worth identifying the cause of the problem first. There may be things that you can change day to day that might help, such as avoid working without a wrist support if at a desktop computer, using tools with bigger grips or wearing padded gloves, and learning to use the muscles of the upper arm and shoulder to take the strain off your elbow whilst keeping your wrist neutral. This is a thumbs up position. There are, however, different methods of treatment you can try depending on how severe the condition is affecting you. So I'll go through some gentle ones first for if it's flared up and work through to more intense exercises when you're in a position to build the strength of the extensor muscles. You will only need a tennis ball and a small hand weight or filled water bottle, and if you have a therapy band, then this can be used as an alternative for a couple of the strength exercises. Right, let's take a look at them. If your tennis elbow is really inflamed, then it's best not to aggravate it with placing more loaded stress on the muscles. Therefore, with your arm supported on an armchair or table or desk, start with the tennis ball on the belly of the muscle just below the site of the pain and gently press and move the ball around, working into the muscle fibers. At the same time, you can also keep the ball on one spot with a small amount of pressure while moving your hand and wrist around to move the muscle rather than the ball. This can bring some pain relief in the same way that some people use an elbow strap just below the site of the inflammation to use as a counter force to take pressure away from the tendon while they're using their arm during day-to-day activities. It may be beneficial for some people to stretch their forearm flexors because if these are tight, they could be adding to the workload of the extensors. To stretch these muscles, place your arm out in front of you with the elbow straight and the palm facing up. Use your other hand to grab your fingers, pull them down and back underneath, generating a stretch from the wrist to the elbow. Hold this stretch for a good 30 seconds, release for 10 seconds and then repeat the stretch a second and even a third time. You can always check to see if your opposite arm is more flexible, signalling that the forearm flexors need some attention on the affected side if they feel significantly tighter. For this next one, start with your affected arm supported, holding a tennis ball in your hand off the edge of your support. Using your other hand to apply some gentle pressure to your forearm extensor muscles, begin to rotate the wrist in a 360-degree movement, changing the direction of the rotation after a complete circle. Do this 10 times or 5 times each way, and this one can be useful immediately before doing any strength work. When the inflammation begins to calm down a bit, you can try some isometric exercises. This is a static muscle contraction against a resistance. Rest your arm on an armchair, desk or table with the palm facing the floor so your hand is off the edge, like with the wrist rotations. Keeping your wrist straight, use your other hand to apply pressure down on the back of the hand for a count of 5 to 10 seconds. Release the tension for a bit, then repeat it up to 10 times, providing it doesn't increase any of the symptoms dramatically. The aim is not to allow the pressure to move your hand, therefore contracting the extensor muscles isometrically. The next stage for strength work is eccentric contractions. This is lengthening a muscle under a resistance. Starting in the same position as the isometric exercise, but this time with a small hand weight or water bottle in your hand, lift the wrist up with the support of your other hand, then slowly lower the hand down, allowing it to bend so the extensor muscles are contracting while lengthening. When at the bottom, use your support hand to bring it back up to the start and repeat again. Do this 10 times to complete a set, and you can work up to 3 sets, but making sure not to increase any symptoms of inflammation. You can also use a therapy band for this one, making sure that the other end of the band is anchored below the wrist to apply the right angle for the resistance. The final phase for strengthening is a concentric contraction. This is shortening a muscle against a resistance. This time using the weight or therapy band in your hand like the last eccentric exercise, you should be able to now lift and lower the weight or keep the tension on the band in both flexion and extension of the wrist to really work into the forearm extensor muscles. Think of it like opening the throttle to accelerate on a motorbike. Similar to the last exercise, you can perform a set of 10 reps, then rest for a bit before performing a second or third set. As a progression for this exercise, you can then try it with your elbows straight, using your other arm as a support, which places more emphasis on the working muscles. The last exercise, working in a different plane of movement, is full range supinations with a weight. This is rotating a weight in the hand from thumbs pointing down to thumbs pointing up. You would start in the same way as the previous exercise, but this time hold the weight on one end rather than in the middle, so more of the weight sticks out on the thumb side of your hand. Whilst your arm remains supported, rotate the wrist to lift the weight, supinating, then slowly return it back to the start, pronating, before starting the movement again. As with the last exercise, perform 10 reps working through 2 or 3 sets, and again as a progression you can try it with your arm straight supported by your other arm to make it a little bit more demanding. Do your chosen exercises regularly, every day for stretches and massage, and every 2 to 3 days for the strengthening ones. Do this for a few weeks to obtain some relief from the pain, and don't forget to work on strengthening other global muscles, so include upper arm and shoulder exercises. You can take a look at some of the other videos I've done on this channel if you want some ideas. I hope you can take something away from this video today. If so, please give it a like by clicking the thumbs up button below, and share this video with friends to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.